Today we are going to learn about sulfonamides. These are a group of drugs which belong to antibiotics. These are bacteriostatic in nature, which means that sulfonamides do not kill the bacteria, they simply suspend its growth. Whenever we talk about a class of drugs, we should always try to classify them under 6 headings. Those headings are mechanism of action, organisms which are susceptible to the drug, organisms which show resistance to the drug, pharmacokinetics, side effects, and lastly, a few examples. Let's start with the mechanism of action of sulfonamides. Sulfonamides inhibit E-folate synthase enzyme. To learn more about this, let us look at this flowchart. Para-aminobenzoic acid or PABA gets converted to dihydrofolic acid with the help of folate synthase enzyme. Further, this dihydrofolic acid gets converted to tetrahydrofolic acid with the help of DHFA reductase enzyme. This tetrahydrofolic acid is the active form of folic acid which is used by bacteria to synthesize their DNA, and therefore it is an integral part of their metabolism. By giving sulfonamides to the person, we block the folate synthase enzyme, and thus it is difficult for the patient for the bacteria to synthesize tetrahydrofolic acid. Remember, this is the bacterial DNA synthesis that is being affected by administering sulfonamides. Now you must be looking at this other drug, trimethoprim. Trimethoprim is a drug which inhibits DHFA reductase enzyme. We will talk about trimethoprim later. Let us move on to the susceptible organisms. Streptococcus pyogenes, LGV or lymphogranuloma venereum, Haemophilus ducreyi, Haemophilus influenza, chlamydia and toxoplasma. Sulfonamides are the drug of choice for toxoplasmosis, which is caused by this organism, toxoplasma. Staphylococcus, E. coli and anaerobes are resistant to sulfonamides, which means that they do not respond to sulfonamides. Now coming to the pharmacokinetics. Pharmacokinetics, as we know, is discussed under 4 headings: absorption, distribution, metabolism or excretion, which is generally remembered by the acronym ADME. But here I am only mentioning the 2 most significant points of the pharmacokinetics of sulfonamides. First being plasma protein binding. Sulfonamides are highly plasma protein bound drugs. Now what is this significance of this point? As sulfonamides are more plasma protein bound, they have a longer duration of action. Now, sulfonamides get acetylated in the liver and their products get precipitated in urine. This leads to crystalluria, which is a significant side effect of sulfonamides. We'll learn about it more in the consequent section, that is side effects. We have 3 most important side effects under sulfonamides. The first being crystalluria. As we just saw, that the products of sulfonamides get precipitated in urine, which leads to crystalluria. To counter this side effect, we should advise the patient to drink more fluids, and we should alkalinize the urine of the patient, as sulfonamides will get ionized and they will be excreted easily. The second side effect is kernicterus. Bilirubin is also another compound which is highly plasma protein bound. Now, if we give an other highly plasma protein bound substance, it is natural that something that is already bound to the plasma protein will get displaced. This is what happens in this condition. As bilirubin was already bound to plasma protein and we have introduced a new drug, that is sulfonamide, in the body, bilirubin will get displaced from the plasma protein, its numbers will increase in the blood, and finally it will cross the blood-brain barrier and cause kernicterus. This is how kernicterus comes into place. The third important side effect is Steven-Johnson syndrome, which is a type of a hypersensitivity reaction, which is frequently seen as a common side effect of sulfonamides. Now let us look at a few examples. On the basis of duration of action of sulfonamides, they can be classified into three types: short acting, intermediate acting, and long acting. One example of a short acting sulfonamide is sulfadiazine. An example of an intermediate acting sulfonamide is sulfamethoxazole. Remember this name, it is of consequence. We will learn more about it later. The third one is a long acting drug, which is sulfadoxine. Sulfonamides as a group are presently only used more in local form. So here are some local forms of the drugs. Firstly, we have sulfacetamide sodium, 10 to 30% of which is used in eye infections. Then we have sulfadiazine, which prevents infection in burns. Lastly, we have sulfasalazine, which is used to treat ulcerative colitis and rheumatoid arthritis. Now, we have to talk about a few more important points about this group of drugs. Trimethoprim. Didn't we just talk about it in the mechanism of action? Let's go back. So by now you must be an expert in this flowchart. PABA gets converted to DHFA with the help of folate synthase, and DHFA gets converted to THFA by DHFA reductase. Sulfonamides block this enzyme, while trimethoprim blocks this enzyme. But the first line that I told you in the beginning of this video was that sulfonamides were only bacteriostatic drugs, which means that they couldn't kill the bacteria, they only suspended its growth. This was because they can inhibit only one enzyme in this pathway. But what if we introduced trimethoprim along with sulfonamides? Both the enzymes will be blocked, and thus the whole pathway will be blocked effectively. And this is what will lead to the formulation of a bactericidal substance. This was what led to the discovery of Cotrimoxazole. This is a fixed dose combination of sulfamethoxazole and trimethoprim in a ratio of 5:1. Now, a fixed dose combination is a drug which is made by the combination of two or more drugs to effectively combat the organisms. This is bactericidal in nature and therefore more effective than giving sulfonamides alone. Uses of cotrimoxazole are urinary tract infections like prostatitis, respiratory infections, and diarrhea. Cotrimoxazole was also used in cases of typhoid fever earlier, but this has been discontinued as they could not get rid of the carrier state and they were not efficient. Spectrum of cotrimoxazole is E. coli, Salmonella. As I said, it is effective against enteric fever but not used nowadays as better options are available. Shigella, Pneumocystis jirovecii. The side effects of cotrimoxazole are megaloblastic anemia, rashes, and this drug is contraindicated in pregnancy. Lastly, I hope you paid attention. Then you must know this point that sulfonamides are the drugs of choice for toxoplasma, or they are the first choice of treatment. Thank you so much. I hope you gained something from this video.